past, cholera infections were common in many countries around the globe. Now they are mostly confined to developing regions because the disease is associated with poor nutrition, poor water quality, and poor sanitation. Only 26.5% of the Nigeria population use improved water drinking sources and sanitation facilities, and 23.5% defecate in the open. Let's join a family physician, Dr. Ebuta Agboneji, who revealed the causes, symptoms, and prevention, among other insights, with regards to the disease cholera.
Well, cholera, in the simplest form, it's a condition that is caused by the bacteria cholera and the bacteria Vibrio cholera. And the bacteria itself would typically cause watery diarrhea to a large extent. And so cholera is an illness that is caused by the bacteria called Vibrio cholera. But in more objective terms, for public health reason and for ease of definition in the health space, you would say that cholera has occurred, or an outbreak, or you suspect a case of cholera when you have a patient who is more than 2 years old and is having, that patient, he or she is having a severe watery diarrhea that has led to debilitating illness or even death. That's in one situation. And then, of course, when you have the public health institutions or the public health agencies have recognized that there is an ongoing outbreak of cholera, any patient you see with watery diarrhea, you are supposed to suspect that that is a case of cholera.
The cholera disease outbreak remains a global threat to public health and an indication of lack of social development. We're here at the residence of May Angwan Mission 1 massacre, where about 7 persons in a family were infected with the disease cholera.
Massacre, a district of Karu local government area of Nasarawa State, is one of the communities struck by the cholera disease. The household of the May Angwan Mission 1 massacre, Salisu Diko, and 6 other members of this family were devastated by the disease, and they shared their experience. It appeared they had contracted cholera from consumption of contaminated water and food.
Around 1 in the midnight, I go toilet once. By that toilet, when I go, it was water from my anus. And actually, that very day, the food that I eat, not ever, with a vegetable. So that night, the thing started.
On Friday, I went to the market. I began selling my wares as I usually do. After a while, I started feeling the urge to fart, followed by intense constipation. I stood up and went to the toilet to relieve myself. Then I came back and continued my business. After a while again, I felt my stomach churn.
It all started on Monday when I went to the market in the afternoon to get some things in the market. So I started having running stomach. So I rushed and I got a bike that bring me home. So as the stomach was running like that, the stooling started. I went to the toilet once. Later again, I still feel running stomach, and I went to the toilet again, thinking it's just ordinary running stomach problem. It couldn't stop.
It started on Saturday in the night around 3 o'clock. When I went to bed to sleep, I started having stomach pain. So I woke my mom that I want to go to the toilet. So when I wake up, I went out stool. When I finished stool, I came back to sleep. Fourth time, my stomach started paining me again, and I went out and vomit. So when I finished, I came back again to sleep. I still went out again to vomit. So guys, I started till daybreak. It did not stop.
Can you elaborate on the symptoms of the disease?
Well, the most important symptom of the disease is watery diarrhea, and occasionally you have vomiting and all that. But the most important and the most typical symptom is watery diarrhea. Is classical in most aspects because it's profuse watery diarrhea. And then when you look at it in a bowl where the person may have passed stool and you've collected the stool and it's in a bowl, you would see watery diarrhea that appears to what you call a rice water stool. And the reason it's called rice water stool is because it looks like when you have washed rice over and over, like when you are cooking it, it looks like whitish like that. But the main reason that happens is because you have what you call mucus flakes in it. So it's a pathognomonic manifestation of it's a pointer that the patient may have diarrhea if you see rice water stool, especially when there is an increase in the number of reported cases of cholera.
The severe symptoms made them move to seek help at a private clinic.
As I came out, I sat down here. I told one of my child that I think I'm not feeling fine because I got toilet almost twice in that midnight and all no water. So it was unfortunate. I see my body is very weak and this my tongue dry. From there I get up. On my way coming here, I fall down. Are you getting me? So from there I crawled with leg. There's a certain water here that rain fall. I go choke my mouth inside. I drink the water. Then my body come. I have a strength.
My stomach continued churning till I started vomiting. I had not eaten anything prior to my coming to the market. I had eaten tuwo the night before and I vomited it entirely. I started feeling dizzy and my eyes were rotating in my head. The people who were beside me noticed and they asked me to sit down, then go home to rest. I indicated with my hand that I heard them as I was totally unfocused. I started on my way to the hospital. Immediately I got there, I started purging continuously, back and forth. My son, who took me to the hospital, was worried about my condition. He noticed the frequent trips to the toilet. I was still purging intensely and uncontrollably. I knew it would get worse if I did not do something about it. So we entered the hospital and the doctors asked me about how I felt, admitted me and gave me drip.
What are the risk factors, perhaps the disease determinants or the causes of cholera?
Well, Well, I talked about the primary symptoms. Before I talk about the risk factor, it's critical to understand that watery diarrhea is can create a lot of problem for the patient because in addition to loss of water, there are lots of other chemicals. We call them electrolytes. All these can result in dehydration. Severe dehydration is a massive killer of especially children under 5 to a large extent, and it can cause shock where the person may have lost so much fluid and the person's blood pressure drops, and that can lead to death. So patients, apart from watery diarrhea, may have signs of severe dehydration and may be so debilitated that it can lead to death. So in terms of signs and symptoms, I think it encompasses all of this. When you talk about the risk factors obviously will be people who exposed to Vibrio cholerae, because to contextualize it to place it in context, Vibrio cholerae exists in feces. It exists in feces. I would say that again. So people who have or eat or drink from sources that have been contaminated by feces. So people who are in unhygienic environment are more at risk of developing these people, and those people typically will be people who have challenge with, who have a very low economic power. So you have people in low and middle income countries who have a poor source of water supply, and in their community and who have poor infrastructure in terms of proper disposal of feces, and where you have a high practice of what you call open defecation, because Africa, in fact Nigeria, comes quite high when you look at the indices. In fact, open defecation is a very common practice. We see people urinating, we see people just branching somewhere in the course of their daily activities to pass through. So we do not have a policy of massive public toilets where people can access and they relieve themselves when they have need to do that. So this results in indiscriminate open defecation. And when you have this, and people are defecating in the open, they are not burying their poo-poo. They may defecate and rain falls and washes feces into water bodies. And people go to those water bodies to fetch those waters for drinking and all that, especially because we, in most part of our country, in fact, in the continent, you do not have a solid infrastructure for water work supplies and all that. So indeed, poor and unhygienic environment are significant risk factors. Also, in people who have what you call hypochlorhydria, so people who have a low acidity in their stomach. For example, people who may be taking medications for ulcer. Some of those medications like antacid neutralize the acidity of the stomach. And the way nature has structured it, the acidity of the stomach is one of our defense mechanisms against infection. So, for example, you may have drank water from a contaminated source, and by the time you drink the water, and the water is contaminated with the bacteria, Vibrio cholerae, when the bacteria gets to the stomach, the acid produced by normal functioning of the stomach will neutralize the bacteria. And once those bacteria are neutralized to a large extent, as soon as those bacteria are neutralized, you are safe. But if you are taking antacids and the bacteria and the acid is not there, the bacteria comes in and is able to pass on and create problems down the line. Apart from that, they've also been shown that patients whose blood group is blood group O, interestingly, I'm also blood group O, so I'm at risk of going by that, but it's been shown that people with that blood group may have a higher risk of developing Vibrio cholerae if they are infected. But it's important to know that it's not everybody that will get Vibrio cholerae ingested that would have problems, would have been infected and develop cholera, clinical cholera. Some people are more likely, that's a blood group O. And then people who drink large amounts of contaminated water or eat large amounts of contaminated foods, because the bacterial load is critical and important.
Let's talk about prevention and control. How feasible are these measures?
Well, the measures are, everybody is a stakeholder, everybody has a role. And prevention may be at the level of the government, it may be at the level of the private sector, it may be at the level of our homes, it will be at the level of schools. So if you look at it at the level of the government, we have said here that a major risk factor is drinking contaminated water. And we know that most people drink water from their borehole or what they buy and all that. So some of the things we need to look at is, for example, is if you have a borehole and the borehole is sited within a certain distance from a public latrine, a pit toilet or something, underwater contamination is a significant source and all that. Or water runover, like water from rain, that washes away stool and all that to water bodies, is a significant contamination of source of contaminant. And then again, in people who buy sachet water, buy bottled water, there is need for the regulatory and the supervising organizations or agency to step up their monitoring activities to ensure that these waters are safe. Because I think we have come across situations where people actually just fetch water from public water bodies, and they go and supply it. So water that are supposed to be sold as sachet or bottled water or dispenser water should be treated. They should be portable. They should be safe. Should be properly treated for for drinking, properly filtered too. But we have a situation where a lot of people are into the business of selling water, but they are not under supervision and all that. So that is a significant area. The third area is the area of public hygiene. Public hygiene has to do with efforts to mitigate and reduce the prevalence practice of open defecation. I mean, we come high up on the list of countries that open defecation is very high. So we need to be able to educate people about the dangers of open defecation to our health system. In addition to that, we also need to probably look into the provision of public toilets. We need to go into provision of public toilets. And I think this is an area for public-private partnership where people would have places they can relieve themselves. Interestingly, if you travel a lot by road, you find out you go to certain parts of the countries, certain parts of the countries along the route. When you stop, you have public toilets where you can pay to ease yourself. No matter how small it appears, that is a significant way of controlling open defecation. So this has to be deepened. People need to know that public open defecation is a problem, and that there are facilities where you can pay a token instead of running into a bush and relieving yourself. You can go there and relieve, and that will prevent contamination. Then when you eat vegetables are a common source of contamination too, because vegetables are usually they are grown and they are sold by vendors who are not educated and who do not understand the issue, how to maintain hygiene. So when you buy vegetables, you need to be careful too. You need to clean them up. You need to wash them up before eating them, and of course, at all points in time, stay on alert. The other issue is the issue of hand hygiene. Hand hygiene is very important. It will shock you to know that when a child has cholera and the mother cleans up the child, the mother can transmit it, can be infected from just that interaction and become infected with cholera and other people in the house who are involved. So it's important that when you come in contact with stool at any point in time, whether you're cleaning yourself or you're cleaning a baby who has poo-pooed, you need to maintain hygiene at all points in time. So in a nutshell, in terms of prevention, it's a very holistic thing. Government has to have a clear policy to provide infrastructure for safe source of water for the public so that people do not have to dig boreholes or wells that can be easily contaminated. And then government has to have in place a system that disinfects this water in a sustainable manner. Then number two, government has to create an environment that discourages open defecation and providing an option for people instead of open defecating. Then health education massively, especially then even in schools, it has to be hygiene is a common aspect of curriculum in the primary and the secondary. This has to be encouraged at all levels. People need to know that hygiene is a critical component of maintaining sound health to a large extent. So cholera is something that can properly be dealt with. So food, water, defecation, and personal hygiene are the critical components and the pillars for mitigating cholera. Apart from that may just be in preventing what we may call primary prevention, preventing it from even coming up. But there's something we call secondary prevention, preventing patients that may have developed it from having complications. Like I told you, people who have cholera may lose massive amounts of fluid from their body, become dehydrated, and actually die. Most of them die from what you call dehydration and what you call abnormal electrolytes in the body. So when people manifest with symptoms of cholera and they are taken to the hospital, the health workers, right from the primary healthcare upwards, right from the nurse, from the community health extension worker to the doctor, to other health workers, should be able to realize it and immediately provide the interventions that will reduce the risk of death. And of course, massive health education through radios to mothers on the use of ORT. As simple as that intervention is, it's a cheap, basic intervention. And if a child is having cholera, one of the things you want to do is that every fluid that child loses, you replace it. And after a couple of days, the diarrhea will stop. So health education massively will reduce people who have cholera. And that is significant. The use of antibiotics too has to be available. These antibiotics have to be available. They have to be cheap. And then we should have a system that guarantees the logistic backup for the distribution and sustainable availability of these antibiotics, especially when you have cholera outbreaks, because there's a role for antibiotics in treatment, there's a role for antibiotics in prevention. So that information has to go there, and there has to be sustainable action to back the supply of those medications.
The household of May Angwan Mission 1 massacre say they are now in recovery and have better approach towards their food and water hygiene.
The doctor advised us to wash our hands and wash the food we take in properly, although we do that normally. I believe if sickness attacks your system, it will do so regardless of these precautions.
If you ask about the water, that borehole is half taste. I cannot lie. But unfortunately, we manage like that, time to time. But if, as you have money sometimes, we normally go and buy pure water to manage again when there's money with that.
It is obvious that communities like Massacre need immediate intervention from the Ministry of Health, the Primary Healthcare Development Agency, and Nigeria Center for Disease and Control to curb the spread of the disease cholera.
The conversation around cholera cannot be overemphasized. Let's go on a quick break. We'll be right back. The proportion of people who die from reported cholera remains higher in Africa than elsewhere. In Nigeria, huge outbreaks were recorded in 1991, 2010, 2014, and especially 2018, where 43,996 cholera cases and 836 deaths were recorded, a case fatality rate of 1.9%. Dr. Ebuta Agboneji, a family physician, has more insight and detailed information. Let's join him again.
In terms of intervention, there can be several. There can be upstream, downstream, midstream, and all that. But one critical component, one critical intervention is the intervention that is as basic as health education. Allowing the public that you have to boil your water, you have to filter your water, especially if you cannot guarantee the safety. You cannot go to a stream and fetch water and just drink it. Somebody may have gone upstream to pass stool. And like we said earlier, cholera is from stool. Anybody who has cholera has eaten a little poo, even if it's a tiny bit of poo. I mean, that's where cholera is. So if you get water, it is ideal that people boil their water. And if it's not pure, if it has impurities and little particles, you filter it to a large extent. So that is a basic health education that needs to go out there, that every community, in the hamlets, in the villages, in the local governments, in the wards, everywhere, people need to start boiling their water before they drink. That is a low-hanging fruit that the government can leverage on and deepen knowledge immediately. But on a medium term, government can also improve the capacity of their primary health care centers to respond, to identify cases early, outbreaks, clusters of outbreaks, intervene, treat patient, escalate that information to be shared in the health public space that, look, it appears there's been an outbreak here. We need to create a surveillance. We need to be more aware. We need to deepen knowledge. We need to now remind people of what they need to do. So that information sharing has to be there. Government can create the opportunity to push that through. A third thing the government can do, which a bit is long term, is to provide public water works infrastructure. You cannot underestimate the advantage of a public water work infrastructure, because when you have a public water work infrastructure that delivers millions of cubic of clean water, potable water, safe water, you reduce most of the diseases like cholera, like typhoid, that are transmitted by contamination of water sources. That alone saves a lot of money for the country, save a lot of money for homes, reduce the risk of people falling ill and falling into poverty, because we know that health conditions, health situations, illnesses that people suffer is one of the risk factors that can push a family into poverty.
Let's talk about medication and the treatment of these diseases.
The most important component of diarrhea treating cholera patients is replacing the fluid. The antibiotics are also a critical component, but replacing the fluid is a major part. Then a medication called zinc is usually used for patients with cholera and diarrhea generally, because to a large extent, what it does is that it aids the intestine to recover quickly and then to reduce the quantity of fluid that is lost. So those are the three critical treatments: fluid, antibiotics, and zinc. And of course, apart from treatment, when you are treating somebody who clearly has cholera, there are people who are at risk. You may give them preventive therapy. That may just require a single dose of antibiotics.
Throughout history, improved health has been one of the main benefits of development. Prioritizing one's health is a step towards improving longevity. As they say, health is wealth. We have come to the end of this episode on healthy living. Do join us again another time. I'm Aisha Salihu. Bye for now.